Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you so much, everyone, for joining us today. We're going to go ahead and get started with our July Learning Circle, inshallah. So today's session is going to be on minority mental health, reducing mental health disparities among minority communities. And we're so lucky and grateful to be joined by our very own Maristan clinician, Sister Zainab Khan. So to start off, inshallah, I'm going to talk a little bit about what Maristan is as an organization for some of you who are just joining us for the first time, or for those of you who are returning to our learning circles, welcome. We're so grateful to have you all here. So the literal meaning of Maristan is an institution of healing, which were the first treatment centers for treating psychological illnesses in our Islamic history. Our organization, Maristan, is a clinical, educational, and research-based initiative which is inspired by the historical function of traditional Maristans, which provide holistic treatment based on environmental and personal factors for the well-being of the mind, body, and soul. Our goal as Maristan is to revive the Islamic tradition functions of Maristans by leading professional clinical care, education, and research in advancing holistic mental and spiritual wellness. So alhamdulillah, today we're going to be holding one of our monthly learning circles, inshallah. To start off with a few learning circle agreements, we want everyone to understand that this is a safe space. There will be a shared microphone segment of the session. There's the opportunity to ask questions via the Q&A function at the bottom of your screens, which you will find, inshallah. And please feel free to ask questions throughout the session, which we will engage in the latter half of today's learning circle. There will also be an opportunity to use the raise hand function if you would like to verbally ask questions and engage in conversation with the rest of the attendees, which will be led by Sister Zainab, inshallah. Please be mindful in what you say, thinking about any possible triggering scenarios that may be difficult for people to engage during the session today. If you choose to and you are comfortable, please share your name. Please remember the Q&A session will not be recorded. And we would like the mic for everybody to feel safe, honored, and heard, inshallah. Please also keep your comments and your questions relevant to today's session and our current discussion. If you have any other questions regarding Maristan, please use the chat box or the Q&A function. I'll be happy to engage them there, or please feel free to email us. Please keep comments short and allow time for everybody to share and the opportunity to ask questions. And then, of course, we ask for no disrespect or derogatory commentary during the Q&A session. Again, we want this to be a safe space where people feel comfortable in engaging with one another. Before we keep going, I'd like to talk a little bit about what our learning circles are. So Maristan learning circles are community-focused psychoeducational support sessions which engage the holistic, spiritual, and mental health needs of Muslim communities. And so really what this is an opportunity to engage Muslim mental health care from a psychoeducational level that we try to make as available and accessible as possible by holding them online. So to introduce our speaker today, inshallah, we're joined by Sister Zainab Khan, who is a dedicated associate professional clinical counselor and nationally certified school psychologist with an MA and EDS degree in school psychology from California State University, Sacramento. She works as a therapist with Maristan, offering strength-based, culturally sensitive approach to therapy, focusing on holistic healing and personal growth. Sister Zainab utilizes a range of therapeutic modalities to support individuals and families in managing stress, navigating family conflict, understanding neurodiversity, dealing with trauma, and enhancing emotional well-being. She's passionate about supporting diverse communities. Zainab brings a wealth of experience to the fields of education and mental health, and she aims to provide a compassionate, non-judgmental space where individuals can explore their emotions, understand behaviors, and achieve their unique goals. Zainab is committed to supporting minority mental health and advocating to break down barriers and stigma, ensuring equitable access to care. Before I hand it over to Sister Zainab to start us off, inshallah, I'd like to go over a bit of the objectives of today's learning circle. Today's Learning Circle is in honor of Minority Mental Health Awareness Month, which is July. And today we will be highlighting the prevalence and impact of mental health issues within minority populations, emphasize the importance of recognizing and addressing these disparities, and discussing the various barriers that minority groups face in accessing mental health care, including structural, cultural, economic, and policy-related obstacles. And I believe Sister Zainab will go a little bit more into the objectives as well before she starts us off. So with that, I would like to hand it over to Sister Zainab, inshallah.
Thank you so much, Janan, for the very warm welcome. Inshallah, I'll start by sharing my screen so that you can see the presentation. And hopefully we're able to see that on the screen. Welcome today. As Janan said, we will explore the critical issue of mental health disparities among minority populations and explore strategies to support in reducing some of these barriers that we encounter. And when we define minority groups, this includes racial, ethnic, religious populations that differ from the majority. And addressing mental health is so crucial because as minorities, we often face unique challenges and higher levels of unmet mental health needs in our communities. And this is a topic that I have always been extremely passionate about, and why I went into the field of mental health. I wanted to break the barriers and stigma in accessing care. I come from a South Asian and Pakistani background, and growing up, mental health wasn't as openly talked about, and there wasn't as many diverse providers or providers that would understand the needs of our community. And I feel like our generation is changing and more openly having these much needed conversations. And it is organizations like Maristan that support our diverse Muslim community and also create and facilitate these spaces to have these conversations. And looking at the objectives for the presentation, I'm going to start with highlighting the prevalence of mental health and the impact within minority populations. We're going to discuss the various barriers that minority groups face in accessing mental health care, including those of structural, cultural, and economic, and also policy-related obstacles that come up for many of our communities. I'll also provide insights into the mental health challenges faced in the Muslim community specifically. We'll also get into a discussion on the role of cultural and religious factors in shaping mental health experiences and accessing care. Along with that, I'll present some evidence-based interventions and ways to effectively address mental health issues within our minority populations, as well as encourage collaboration among mental health professionals, community leaders, organizations to create a more inclusive and effective mental health care system for minority groups. It's so crucial that we have this sort of collaboration within our communities because we are so faith-based and we are so integrated. It's helpful to have our religious organizations collaborating with our mental health organizations and really creating a cohesive system of supports. So when we look at the mental health disparities in treatment, this image illustrates a significant racial disparity in mental health treatment among children. It compares the percentage of white children from diverse and racial ethnic backgrounds who receive mental health services. And the implications of this data show those racial disparities in care and the impact it has in our ability to access services. When we look at minority populations, there is a clear gap in accessing mental health services between our white children and children from diverse backgrounds. They typically white children are more than twice as likely to receive mental health services compared to their peers from diverse racial and ethnic backgrounds. When we look at racial disparities in mental health treatment for children, a lot of that research shows that minority populations often experience higher rates of mental health challenges, and only 13% of those children from diverse racial and ethnic backgrounds receive the care and support that they need, compared to 31% of white children that do receive services. And it also has a lot to do with our ability to facilitate these conversations and discussions. And I think that as a community, we're growing in our understanding of mental health and our awareness, and it's starting to be a topic that's talked about a lot more often in our communities. So when we look at the diversity among Muslim Americans, Muslim immigrants typically come from almost 75 different countries, making it one of the sorry about that. So when we think about this diversity among our immigrant population, we have a very diverse group of Muslims that live in California and within the US. And across the nation, there's Muslim immigrants that live here that reside from 75 different countries, making it one of the most diverse religious communities in the US. And approximately 42% of Muslim Americans are US born, while 58% are immigrants, with more than half of those immigrants moving to the US in the last 2 decades, leading to different acculturation challenges. And it becomes really difficult coming into a new country and trying to fit in and find your place. And this is what a lot of our youth tends to struggle with sometimes. And so when we look at the disparities in mental health, a big part of that is knowing how to access services. And a lot of our immigrant population doesn't have access to those resources, or is not able to get the support that they need. And additional statistics that we look at among our mental health Muslim community is suicide is a growing public health threat and is one of the 10th leading causes of death in the US. There's research from Stanford Medicine that have found that Muslims have a greater risk of suicidal ideation because we're not having, all of those structural barriers are coming in the way of accessing care and treatment. That's why it's so important for organizations like Marasan to have support for our communities. And so when we look at the social stigma aspect of seeking mental health care, this brings up a lot of conversations on, how many stigmas there are across cultures in seeking mental health treatment. And sometimes this is often considered as shameful within the community. Due to that social stigma, many people don't get the treatment and care that they need and would benefit from in order to be successful in the community, and in order to build a lot of those positive coping skills and build an understanding of their own traumas and their own mental health. And so a lot of this also is impacted by, when we think about our faith-based communities, a lot of us have experienced discrimination in some ways, and that also is a detriment to mental health among Muslim communities. And about 60% of Muslim Americans report experiencing some level of religious discrimination, and the highest, and in a study done in 2016, reporting that this is the highest group in Muslim communities that experience that discrimination. And with the growing concerns that we have sometimes in our community and in the politics and things like that, that creates a lot of rise in Islamophobia, and this becomes really difficult for people in our community to deal with, and younger Muslims and women, and especially specific groups experience more prejudice based on their background and their orientation. And so this religious discrimination is oftentimes linked to depression, anxiety, and other mental health challenges. And so by recognizing and addressing these specific challenges faced by our communities, mental health professionals can significantly improve access to care and mental health outcomes. And so the more awareness we have in our communities, the higher level of access to care and the higher level of access to community supports and wellness. So when we look at mental health data in our minority communities closely, this also includes different racial groups, including American Indian, Alaskan Native populations, and these populations experience disproportionately higher and increasing rates of mental health challenges compared to other racial and ethnic groups. In these communities, children have 14.2% or 14.2 times higher the likelihood of being exposed to 2 or more household adverse childhood experiences. And when we look at the data and compare within racial groups, some of our Asian households, they typically have 52.9% of children reporting having a caregiver who is struggling to cope and or lacks emotional support for parenting and guidance. And so we're noticing a lot of needs in not just supporting our children in the community, as well as our caregivers and our parents in the communities. When we look at the Hispanic population as well, Hispanic adults had a 1.7 times higher rate of experiencing a major depressive episode in the last year compared to some of our Asian community. And so a lot of these experiences I've touched on adverse childhood experiences. And so when we look at ACEs, this refers to potentially traumatic events that occur in childhood, such as abuse, neglect, household dysfunction, and in minority youth specifically, ACEs can be more prevalent due to the systemic factors like poverty, discrimination, and limited access to resources. These experiences can also significantly impact their mental health and their well-being, contributing to higher risks of developing behavioral and emotional challenges. And so the sooner that children receive treatment and care earlier in their life, the better chance they have at taking preventative actions and building healthier coping skills. So when we look at the impact of ACEs, children living below the federal poverty line in 2021 were 2.7 times more likely to have experienced 2 or more of the 6 household level ACEs compared to households at or above 400% of the poverty level. And so this contributes to having these stressful and traumatic events in a child's life, which can significantly alter their health and their well-being, and impacting their development and functioning into adulthood. And a lot of these ACEs sometimes in our households can be impacted by divorce in families, the death or imprisonment of a parent or a guardian. Sometimes this includes living with someone who has a mental illness, is suicidal or severely depressed, and is not able to access that treatment and care. There's also instances where living with someone who has a problem with alcohol or drugs can impact adverse childhood experiences, and also witnessing violence within homes can have a detrimental impact. And according to overall America's health ratings, 9.9 million children in the US have experienced at least 2 or more of the 9 ACEs. And so it's important in our communities to address this, and specifically our minority communities. For example, Black youth have a 7.2 times higher likelihood of being exposed to 2 or more household ACEs. And in order to address the disparities and reduce the disparities in our communities, we have to have these conversations and address the adverse childhood experiences and making sure that our children are getting therapy and care, and also being a proactive advocate in getting them services that they need. When we look at the prevalence of mental health in Muslim youth, this research is from the Family and Youth Institute, and approximately 18% of our Muslim youth, experience depressive symptoms at similar rates as non-Muslim youth as well. And so approximately 20% do experience trauma, domestic violence, cultural conflicts, Islamophobia, and discrimination. And this is a unique but also collective experience that we share as Muslims, that you come across in a country, but that is also diverse, but there's also a lot of racial tension at times, and there's a lot of discrimination. And existing data shows high rates of adjustment disorder as well experienced by the Muslim Americans seeking mental health treatment, which is suggestive of the challenges of acculturation and adjustment, as well as discrimination in our society. And so when we have our immigrant youth that come in from different countries, they oftentimes have a really difficult time settling in and adjusting to being in a new country, and having the support and resources. Language barriers also play a role, and this tends to impact mental health because it's hard to come into a new country and have those same access to resources as you have in your country back home, because you're adjusted and you're used to all of the resources and your ability to communicate to people around you. And so a lot of times our immigrant population ends up feeling alienated and feeling without a lack of support or adequate support. And so when we also look at 19% of youth that experience these adjustment disorders, this includes the stress of balancing those cultural and religious expectations with the demands of mundane life. And so a lot of our youth today struggles with balancing cultural, religious expectations, and then, also understanding the Western perceptions and how that differs from their own cultures and their own identity. And so there's a process of identity development and searching and finding, meaning and purpose in our faith and in our culture as well. And so these stressors can also have an impact on emotional and behavioral challenges such as anxiety, depression. Sometimes this can lead to difficulty in school and social settings as well. There's also 16% of youth that present with hyperactive, inattentive, or combined presentations of ADHD symptoms. And when we look at the rest of the prevalence of mental health struggles, 15% or below present with mood, anxiety, and in some cases, substance use disorders. And so these factors that impact Muslim youth and we identify these struggles that our youth is facing, and they find it difficult to balance these different identities within their home life and their culture, and also sometimes at school. Youth find it hard to identify with when we think about, for example, our Black youth and our Muslim youth. they have a higher likelihood of experiencing higher levels of depression. And the struggle stems from some of those challenges of different cultural and religious and social expectations, and also some of those structural and historical traumas that we've experienced in the past. And so this is impacted by, when there is a lack of community and belonging in our youth today, who don't feel that sense of belonging to any community, or typically report a greater mental health challenges. And this sense of belonging is so crucial for mental well-being, providing support and a sense of identity and fostering that in our youth today. When we also look at the prevalence of religious discrimination, approximately 55% of high school students and 78% of college students experience religious discrimination. This high prevalence indicates a significant issue impacting many young people. When we look at Black Muslim youth who face various issues, including academic, religious, and cultural hostility, sometimes that makes them feel like they're not being supported or welcomed in various settings. And this leads to a further feeling of isolation and distress. And so it's so important to advocate for our communities and getting support, and when they're in school, making sure that they are not encountering that racial discrimination in our communities, and reaching out to mental health providers, whether it's in the school system or outside providers and clinics and services, and getting them the support that they need to cope with some of those challenges that they face. When we also look at the challenges that Muslim women, visibly Muslim women face, they encounter a lot of discrimination through wearing hijab and experience higher levels of racism, which is an added level of discrimination that can also exacerbate mental health challenges. And this has a significant impact on youth experiencing discrimination, and they report more mental health challenges like discriminatory experiences directly relating to mental health outcomes. And, even with service providers in the healthcare system, having service providers who are understanding of cultural backgrounds and who are understanding of our communities. Another factor that impacts our Muslim youth is when we look at parenting styles. Some oftentimes unsupportive parenting is characterized by reduced warmth or support. This can also be looked at as control that negatively impacts youth. This lack of support can also hinder their ability to cope with various challenges, and coping with that discrimination without supportive parenting, youth struggle to develop resilience against discrimination, and they find it harder to handle those everyday problems due to the lack of guidance and emotional support. And so it's important to develop that strong Muslim and American identity by providing supportive parenting that helps youth develop a strong and integrated identity, balancing their cultural and religious backgrounds. And this can be done through many different ways, through civic engagement. Youth with supportive parents are more likely to be actively involved in their communities, whether that's religious and faith-based organizations. Having that supportive system creates protective factors for our youth, and the supportive parenting helps youth avoid some of those more risk-taking behaviors like smoking and drinking. So overall, it's important to address the mental health needs of minority youth, and this requires a multifaceted approach that considers the impact of their identity struggles growing up in the Western culture, as well as the discrimination that we face. And also looking at our parenting styles when we approach our children and making sure that we're fostering supportive environments at homes and in our schools and within our religious communities and within our larger communities as well. We can help mitigate a lot of these negative mental health outcomes that these youth face by approaching it in this way. And so another population that encounters a lot of mental health disparities is adults and youth with disabilities. Nearly half of our youth with disabilities have experienced mental health challenges, and 3.4 times higher than youth without disabilities. They were also 2.6 times more likely to have been exposed to 2 or more household level adverse childhood experiences compared to their peers without disabilities. And when we look at adults with disabilities, they were 3.5 times more likely to experience frequent mental health distress compared to adults without disabilities, and nearly 3 in 5 youth with disabilities hold at least one household level of family and personal relational health risk that may have influenced their safety, stability, and emotional support. And so when we look at the various barriers in accessing care, a lot of times this is due to the structural barriers, which can include a lack of available mental health services in minority communities and insufficient insurance coverage. These barriers can prevent individuals from receiving necessary care. When we look at the cultural barriers, such as stigma and misconceptions about mental health, this can also discourage individuals from seeking help. And that's why it's so important to have culturally competent care and have a diverse range of service providers that can address language barriers and can help support in our communities. And specifically relating to Muslim communities, these barriers, as I discussed, such as cultural stigma, lack of culturally competent providers, and religious misconceptions about mental health, also have an impact on those cultural barriers. When we look at economic barriers, such as low income or socioeconomic status, unemployment, and limited education, this can impact an individual's ability to access mental health care and support. And that's why it's so important to be active members in our community to advocate for more resources, low-cost resources for our communities to be able to access supports and services. And so policy barriers can also include laws and regulations that limit access to mental health care, as well as insufficient funding in some communities for mental health. And it's important to integrate social justice into our communities, and therapists should also address these systemic barriers and empower our clients by incorporating social justice principles into their practices. And at a community organizational level, it's important to apply for grants to receive supports for your communities to be able to access services. And when we look at the approach and cultural barriers in therapy, it's also important to decolonize therapy, which involves acknowledging those historical and systemic traumas that also leads to an integrative approach in addressing culturally responsive care and practices and creating more of an inclusive and equitable mental health environment for our communities. And so I have various strategies in supporting our youth as well, as a provider that worked in the school system for many years. I saw a lot of the teens in our generation really struggling to have support, and having adults and individuals that they trust in order to share what's going on in their lives, and just having a safe space to really talk about some of the things that they're experiencing. So it's really important to create a supportive and important a supportive atmosphere for our youth by nurturing their self-confidence and believing in them and supporting their goals and ambitions. And as parents, it's also important to model these positive values and characteristics by using positive self-talk and affirmations as a parent. Children oftentimes see the world through the eyes of their parents, and they will model and mirror those behaviors that they experience, and caregivers as well. And so children will often mirror their parents' behaviors, and so it's important to be aware and mindful of the way we approach them and address them oftentimes, especially when they're struggling and you're noticing that your teen is coming home and is tending to isolate or be in their room a lot more, or they're not spending as much time with their family. Those are concerns that, should raise some questions, and sitting with the youth and fostering that open dialogue and communication with parents and caregivers so that you can talk about what's going on with their mental health. And it's also important to recognize their ability to accomplish their goals. A lot of our youth and our college students tend to take on a lot of stress academically as well. And so it's important to have that supportive atmosphere and that supportive environment for them to come home to, and to be able to talk about the challenges of being a college student and what are some of the stressors that are going on in their day. And so as a faith-based community, it's also important to have those positive religious coping methods that we all use, such as prayer and connecting with Allah in different ways, and finding strategies to model that for our youth, and also creating that relationship and that spiritual connection so that they find some solace and comfort in using those as methods of dealing with stressors in their life. And so a lot of the youth today often belong to multiple communities. They're Muslim, they're American, they're cultural communities. So there's a lot of different identities that we kind of carry and walk around. As a woman, we have very different experiences. And so it's important to be aware of our different experiences and how to foster that supportive environment for our children. And so in fostering this positive communication, it's important to spend quality time with children, and creating some sort of bonding activity and time where you go out to lunch and spend time together and have these conversations about what mental health is like, or what are some of the stressors that are going on in their day-to-day lives. Fostering these strong family connections can also significantly reduce a youth's chances of depression by 40%. And so when we look at youth who do receive some autonomy from parents and have a strong sense of identity and a strong sense of support from their communities, they tend to have more access to those resources and coping skills in order to be to deal with challenges. And so by parents modeling and having these supportive conversation, this protects youth from the negative effects of different things like Islamophobia and strengthens their identities and their well-being. And also decreases some of those risk-taking behaviors because they have this open communication and connection where they can reach out to their parents if they need someone to talk to. It's also important to build positive social interactions with friends and mentors in the community. And this is so important for our Muslim youth as well to attend lectures and community events, to be involved in different activities. And even our non-Muslim youth, it's important to have high quality after school activities and programming that they can be engaged and interactive in, as well as engaging with caring adults outside of their home and adults that they can build those positive relationships with outside of their home system and in different parts of the community. It's also very important to have youth proactively engaged in mental health advocacy and changing those policies, and having youth involvement in mental health education and awareness as well. And so oftentimes our youth tends to resort to using social media to learn about different things or promote mental health literacy and have a better understanding of their mental health. A lot of the teens nowadays often get a lot of those resources from social media or friends and different outlets and resources. And so it's great to have those resources available and also being open to having them connect with different community organizations as well. And so our youth that has involvement in community interventions, this can be utilized by providers to counter some of those experiences that they have of Islamophobia and encourage Muslim Americans to seek mental health care. And when we look at our religious leaders, we often go to them for guidance and support, and they have such an integral role in our community mental health, and Muslim Americans oftentimes might be more willing to seek help from religious leaders than from formal mental health services. That's why it's so important to collaborate with our faith-based organizations and have this communication so that they can provide those resources for community members that are struggling with seeking care and treatment, but also community members that don't know where to get the appropriate services as a Muslim, or communities that have a hard time finding resources for care. And a part of working through all of this is developing culturally responsive therapeutic practices. And so the importance of culturally competent therapy is crucial in creating these inclusive spaces where our minority population seeks out mental health services. We need culturally competent providers that understand, communicate with, and effectively interact with clients across different cultures. It's a process that's ongoing and reflective, and it takes a lot of doing research on your own as a therapist sometimes, and oftentimes learning from the experiences of our clients and their individual backgrounds as well. And so a few techniques in developing those culturally responsive practices include cultural awareness, educating yourself about their background, including their different values and norms, and oftentimes communication styles that we see in a lot of cultures, like in South Asian culture, there is a very collectivistic approach to families and a very collectivistic approach in communication. And sometimes that can be a strain on some of our youth trying to balance dealing with some of their own challenges as well as dealing with some of the family challenges that come up. And so modeling and having those conversations about boundaries and really emphasizing the value and the cultural norms and traditions that we have, it's important to have those discussions with clients from minority backgrounds. And so when we have these culturally responsive practices, this improves client engagement by creating a level of respect and understanding between a therapist and client. This oftentimes leads to better outcomes in therapy. It allows us to build a trusting relationship between a therapist and client. And it is also an ethical obligation to be informed. For instance, the Islamic tradition places a strong emphasis on mental health, and its perspective transcends beyond mind-body dualism, and to integrate both those behavioral aspects and also physical health, as well as our mental wellness. And so all of these factors create a holistic approach to therapy. And so when we work with Muslim clients, and many Muslims oftentimes see prayer and reading the Quran as having therapeutic benefits, and they may utilize these as a source of healing. And this can be integrated into their therapeutic healing process as well. And expressing, oftentimes in our community, we tend to express emotional distress in more somatic terms. And that can also look like having a stomach ache or a headache, and those symptoms of anxiety manifest as anxiousness or feeling really overwhelmed or having different physiological symptoms. And having a sense of awareness and education for clients on what that looks like creates this understanding of the physiological connection between mind and body as well. And so other ways to engage in culturally responsive practices is by participating in cultural competence trainings and workshops that are offered. Marston also does a lot of trainings and workshops. There's a lot of different organizations like PESI, that provide different trainings on cultural competence as well. And as a therapist, it's important to read books and articles and research papers on a level of understanding our different clients, and having this cultural competence in those specific cultures that our clients come to our sessions, and having done that research creates this level of understanding of how to navigate those conversations and how to understand who they are and how that's impacting them as well. For example, learning about the cultural significance of family dynamics in Hispanic cultures, and the importance of community and indigenous cultures as well as Muslim communities. They carry this very collectivistic approach to community. And so as therapists, it's also very important to have a level of self-reflection and in understanding our own biases and what biases we carry as a therapist when we go into our sessions. How does that impact the client, and how is that going to impact or have some sort of counter transference on our clients, and how can we actively work to address some of those counter transference that we might have. And it is very important as a therapist to have cultural humility and approach each client with that cultural humility, recognizing that you are always learning and that client is the expert on their own culture. While it is important to do research and have an understanding so that you can facilitate those conversations, it's good to have clients really express how they identify with their culture and what their understanding or how their relationship is with that. And so, for example, I want you to think about your own cultural background and how that might impact you as either a professional in the field or how that might impact you as somebody that is wanting to seek services in therapy. And what sorts of things come up for you with your cultural background in mind? What are some of the challenges that are very unique to your own cultural experiences? And so as therapists, when we do a lot of this culturally responsive training, we can also adapt traditional models of therapy. Adapting these traditional models of therapy by incorporating it to be more culturally relevant, using narrative therapy for different clients, using different visual representations in your sessions, having more language accessibility, and providing different formats of resources for them as well. And so it's important for our therapists to be trained in different therapeutic modalities so that we can have a very different approach. Sometimes even with narrative therapy, we can use this as a way to facilitate storytelling or have it as a way to facilitate those conversations about cultural backgrounds and the impact of whether it's a Palestinian identity, Pakistani identity, and how that experience has been for them growing up in the West, or how that experience has been challenging for them. And so another therapeutic modality that is useful is the internal family systems model, which can be used to integrate cultural understanding into the exploration of a client's internal parts and family dynamics, as well as further explore the generational trauma or legacy burdens that are carried from ancestors when we think about as a Palestinian and how that has shaped their identity, how those ancestral traumas have impacted them, and incorporating culturally inclusive IFS model. Therapists can use this to recognize and release a lot of the emotional burdens that are passed down through generations, and often tied to cultural or familiar expectations. And this process is often done by acknowledging and respecting the client's cultural background. And therapists can more effectively address these inherited burdens by facilitating healing and empowering clients to develop healthier, more authentic self-relationships within their cultural context. And so by facilitating these discussions, it's also important to have that inclusive environment and space to make the office space more diverse by displaying diverse artwork, by providing different reading materials in multiple languages, offering culturally inclusive resources. This approach will foster trust and ensure clients that they feel understood and respected, and it will also enhance therapeutic outcomes in your sessions as well. And so when we promote equity and access to services, it's also important to create supports that are financially feasible for our communities. And so as therapists, it's important to offer sliding scale fees or pro bono services to make therapy accessible for clients from various socioeconomic backgrounds. And by providing these different ways of payment for clients who don't have insurance or are struggling financially to provide for their family, this gives them a space to also get that individualized support from a community organization. For example, at the Marston Clinic, we offer services and supports for our low-income communities as well that can be addressed through applying for a financial aid application. And if they tend to qualify, then they can receive those supports and services as well. And it's important to have that in order to address those barriers in accessing care for our communities of varying socioeconomic backgrounds. It's also important as an organization to have community outreach and engagement, as well as engaging in community outreach to raise awareness about mental health services. And this can be done through collaborating with different organizations and providing workshops and resources, partnering with different schools and government organizations or community centers to let them know about the different services or to let them know the needs of that community. And so as I wrap up and finalize my presentation, I wanted to hear from others or see if there's any questions that can be addressed, and also have a discussion on what your experiences with barriers and accessing mental health care are like.
Thank you so much, Sister Zainab. Jazakallahu khairan. I think we can go ahead, as you said, move into the Q&A portion of our session, our learning circle today, inshallah. For folks who hopped on a little bit late, welcome. Thank you so much for joining. We do have a Q&A typed option at the bottom of your screens if folks are more comfortable asking questions in that format, but also please feel free to use the raise hand function, and Sister Zainab can answer questions in that format as well. I also want to note that as the learning circle has progressed, I've been sending in the chat different resources and links which relate to the different topics that Sister Zainab has been discussing. So inshallah, those will be helpful. And we'll also be sending these out at the end of the circle, inshallah, for all of you to have access to via email. So as folks kind of think about their questions, and prepared to ask them in the Q&A. We already have one that maybe we can start off with, if that sounds good, inshallah. Okay. So the question is, in understanding the significant anti-Black attitudes in some communities within the Muslim community, which further adds to the challenge of Black Muslims in the US, have there been any studies to explore the impact of racism and discrimination within the Muslim community? And then there's the second part to the question as well. Are there any models of communities or community programs that are proactively addressing this issue successfully in order to increase the support system and decrease the stress that they are potentially facing?
Sorry, Janan, I'm having a hard time hearing. Could you repeat that question one more time?
Yeah, of course. So this question is in relation to understanding the significant anti-Black attitudes in some communities, which further add to the challenges of Black Muslims in the US. And the particular question is if there have been studies to explore the impact of racism and discrimination in the Muslim community. And then there's a second part to the question, which asks, do models of community programs exist that are proactively addressing this issue of racism and discrimination within the Muslim community? And increasing support systems and decreasing potential stressors for Muslims?
Yes, so the Family Youth Institute did a study on exploring the different impacts of the Black community and how that has impacted youth. And there is a higher percentage of youth and adults that do experience mental health challenges in the adversity that they face, and this contributes to a very significant impact in shaping our cultural identity and our resiliency and our ability to deal with a lot of those challenges that we face as minorities. And so there are a lot of studies that have explored the impact of discrimination, and specifically in the Black community as well. And so the second part of that question, I had a hard time hearing.
Of course. So maybe I'll repeat both parts because they feed into one another. So the first part is addressing or studies that have explored the impact of racism and discrimination within the Muslim community. So that's the first part. And then the second part is asking if there are models, which you just touched on a bit, models of community programs that proactively address the issue of internal discrimination and racism, which are successfully increasing support systems and decreasing the potential stress that folks facing discrimination and racism may be facing.
Okay, so we're asking about models of how to approach. Is there a way to type the question? Because I don't know
Yeah,
why
if
the
you look,
audio is presenting really low.
no worries. If you take a look at the bottom of your screen, you'll also have access to the Q&A box, which will show you the question. And I can also type it in the chat box here.
So I'll go ahead and share maybe the next slide, because this has quite a few resources that might be able to answer some of the questions. And so when we look at Each Mind Matters, they have various resources on the statistics and the prevalence of mental health in various communities, as well as different resources for support and accessing those support in African American mental health resources, as well as Asian Pacific Islander communities. There's Latino mental health resources and specific organizations that members can also access different services that are tailored to their cultural background, and being able to find a therapist that speaks Spanish or somebody that has a similar background to you. It's often really helpful to find a therapist that has the same background or a similar background and has that level of understanding of your community and how to really navigate those conversations about those challenges that we individually experience.
Thank you. I think this ties into the next question as well, which is asking for those who aren't mental health professionals, what roles and steps can be taken to address mental health disparities within minority populations inside of our community?
I'm so sorry, Janon. I have my volume up all the way, but I'm still having a hard time hearing. Can you repeat that question one more time?
Are you able to hear me better now? Yes. Are you able to hear me better? No. Let me try repeating the question. So for those who aren't mental health professionals, what roles and steps can be taken to address mental health disparities within minority populations in our community?
So what I'm going to try and do is switch my headphones and see if that makes a difference.
Sounds good, inshallah.
Okay.
Can you hear me better now?
Yes. So much better.
Okay,
Yes.
alhamdulillah. Okay, perfect.
Okay.
Okay, so I will repeat the question, which is the last question. So, for those who are not mental health professionals, what are roles and steps that can be taken to address mental health disparities within minority populations inside of the Muslim community?
So I think it's so important to have those open spaces to have discussions with our community and different people in the community about mental health. And so creating open spaces to have those discussions is really important. Really collaborating with community organizations and having some sort of mental health seminars within the community as well, for a chance and an opportunity to really advocate for, different backgrounds to attend, for minority populations to go and attend and learn about the different resources in the community as well. Um, and so I think it's important to facilitate those conversations while also reaching out to our policy members and our leaders in the government and those systems to advocate for access to mental health. So even as someone who is not a therapist, you can still play a significant role in advocating for yourself and your community. There's different grants that you can have organizations, whether that's community organizations, apply for different grants to receive mental health services at a lower cost, and to receive that funding so that they can provide those services. So you can play many different roles of advocacy, facilitating and fostering those open discussions, and really communicating with people and having more open discussions about mental health and what's going on in our communities.
Thank you so much. I think we'll probably have time for maybe one more question, inshallah, and then we can wrap up. So for the next question, it relates to the component you were speaking about in the in your last response around coordinating different sessions and material for the community to access. But this is more uh, specific towards Muslim youth who are facing mental health disparities. And the question asks, how would you advise on how to approach Muslim youth in the conversation around mental health, and addressing any sort of mental health concerns that might be taking place?
Mm-hmm. I think it's important to really understand what's going on in their life and what's causing some of those stressors for them. Um, and so with youth, it's, there's a lot of different challenges that they face, whether that's school, racial discrimination, different things that they encounter as stressors. So it's important to have an understanding of what's going on in their life that is causing some stressors for them. If you're observing your child, being more withdrawn, noticing and recognizing that they are being more socially isolated and facilitating that conversation by, expressing concern for them. Hey, I'm really concerned about you. I've noticed that you tend to sit in your room and you're being very socially isolated. What are some things that are going on for you and how can I support? And really fostering that open space to have those discussions. And I believe somebody said, what are some resources for our community? And Marsan is one of those resources, as well as the Khalil Center. There's different Muslim organizations that have very accessible therapeutic services. We offer virtual services in person. And so there's different ways to approach therapy, and providing virtual services also, helps with some of those barriers and being able to go and attend services if you don't have a car or access to different resources to get you to a therapy session. It can be very comforting to be able to do that in the space of your own home. And, you know, having our children and, you know, approaching them with those conversations and saying, hey, I'm really concerned about you. What are some things that you're going through or what's going on in your life that we can have a discussion about? And it's important to foster that open communication, that ability to have that type of relationship where they can go to you if they're feeling overwhelmed and stressed out. And so, you know, even as parents and caregivers, you can facilitate these conversations with your children so that they have that relationship where they can talk to you about the things that are going on in their personal lives.
Thank you so much, Sister Zainab. Jazakallah khairan. I think that is a good point for us to wrap up our learning circle today, inshallah. Before we close out, I do want to graciously ask for anybody attending to complete our feedback form. We really want to continue to hold relevant learning circles that meet the needs of our community and the current interests and maybe difficulties that our community are facing. So I'm sending the form in the chat now if folks can take a couple of minutes just to fill out that short questionnaire. I've also sent a list of resources in relationship to the last response that Sister Zainab gave in terms of what Maristan is able to provide in terms of our resource page. We have many different resources on there which tackle a multitude of difficulties that are faced in Muslim mental health and resources outside of Maristan as well, inshallah. So with that, we will go ahead and close off for today. Thank you so much, everyone, for joining us. And thank you, Sister Zainab. May Allah reward you for all of your efforts and for sharing your wisdom with us today. Alhamdulillah.
Jazakallah khairan. Thank you so much for everyone for joining as well and listening to me speak and having this very important conversation about mental health.
Jazakallah khair. Assalamu alaikum.